You are a medical practitioner. How best can you tell us what mental health is?
Okay. Thank you, Mr. Akwe, for that wonderful question. In fact, this has been a major area of issue for people. I say people in the public and even people who are educated, who are even working in the health settings. And most times when we go out to do awareness about mental health, and when we move close to people and we are sharing tracts, we say, you guys take care of your mental health, we try to share track to them. And then when people hear the word mental, they say, no, I'm not mad.
I'm not mentally disturbed.
I'm not mad. They don't even use the word mentally disturbed. For somebody to use mentally disturbed,
Then
these
he's
people
aware.
have information about it. But they just go ahead straight away to use that word. I'm not mad. I'm not mad. There's nothing wrong with me. And then they move away. So sometimes we don't give up. We try to move closer to the person that, oh, ma, sir, no. We are not trying to say you are mad. We are just trying to tell you that, mental health, blah, blah, blah. So mental health is literally different from mental illness. But people don't get the gist. So once they hear the word mental health, they think we are talking about mental illness. So all of us, each and every one of us as humans, we have mental health. As we have medical health, we have mental health. But people don't know the difference. And sometimes when people come for clinic at the hospital, or some come for therapy sessions, then I start by explaining that, because once they bring people, their family members bring them, and they say, oh, go and see the psychiatrist. Then the psychiatrist now say, oh yeah, go to the clinical psychologist. When they get there, they start saying to me, ma, there's nothing wrong with me, I'm not mad. I start explaining that no, mental health is different from mental illness. So now, what is mental health?
Exactly.
So mental health is a state of emotional and psychological and social well-being. Is in three places. A state of emotional, psychological, and social well-being. So when somebody is doing well on these three areas of functioning, then we say the person has a stable mental health. But that's not all. There is other things to it. So for us to completely say this person has a good mental health state, then the person must have been able to cope with the stresses of life. The person must have been able to discover his or her abilities while coping with the stresses of life, inside life. Then the person must have been able to contribute to his or her community. Then the person must have been able to be useful to himself and be able to achieve his or her goals. So when the person does well on these four parameters that we have stated, aside that definition of mental health, that it is a state of well-being whereby the person does well on the emotional, psychological, and social states. So the other parameters to it, you would have been able to cope with the stresses of life. You would have been able to discover your abilities while you are coping with the stresses of life. And then you would have been able to work effectively and achieve your goals. Then you will be useful to yourself and then the community at large. Then that is what we call a stable mental health.
That is what is called a stable mental health. I can tell, I perceive it clearly that this is going to be a very brilliant yet educative conversation. If you're out there and you're listening, when the word mental health comes, it doesn't mean you're mad. It doesn't mean something is wrong with your brain, right? It could be a lot of factors considered, just like it has been said already. Now, having said all of these, whether we like it or yes, there is a relationship, there is a link between the mental health and your workplace. You would not be able to function well while you're at work if your mental health is not stable. Now, let's look at it from the medical side. What is the relationship? How can we conjoin both together when we say the mental health and workplace? How do they relate?
Okay, so mental health and the workplace is very, very related in so many ways. So we as humans, I would say the most times of our life are spent at work. I would say that, except for somebody that is a full housewife or a full houseman. Yes, either of those. But for a man that, yes, is working, either you are working in a corporate organization, either you have a business of your own that you do, most time of the person's life, most hours is spent at work. So if the person's mental health is not in a good state, it will definitely affect the work. And it will affect the work in the area of productivity, in the area of reputation, and in the area of retention. So in the area of productivity, so if somebody's mental health is not good, somebody coming to work and then is sad, let's say for example is sad, that kind of person, when he gets to work, concentration is impaired, judgment is impaired, reasoning is impaired, and for such kind of person, you will not be able to deal diligently with the tasks assigned to him for that day. And when maybe bosses are like, oh, Ade, have you treated the file that I gave to you? And the person becomes disorganized and they, no sir. So that is like divided attention for that day. So whatever it is that the person is about to do that day, the input into that particular tax for that day will be very low, and that will affect productivity of the organization. So a mental health that is not in a good state too also affects turnover at work. So the way people turn over, so it could even lead to absenteeism. So the person might call in, please sir, I'm not feeling fine, I won't be able to come to work today. So not coming to work today, it will affect the goal of the organization for that day. So when we now talk about repetition is that, okay, for an organization that we have that let's say they have a toxic work environment there, and then all the time people feel stressed up, people burn out, they are exhausted, they are all that. So a time will come, the person will reach a breaking point and then say, I don't think I can go ahead with this work, it's too stressful, the working culture is toxic, I have a very demanding boss, I have a troublesome boss. So all that, the person might decide to resign. And this one resigns today, the other one resigns tomorrow. That will create a repetition about the organization. And then you say, that place, I just got an offer letter from so organization. The person, you better don't go there. That place, if you are not fit, if you are not fit physically, if you are not fit mentally, I don't think you can cope with the stress of that place. It's very toxic and blah blah blah. So it also affects the reputation of the organization. So mental health is very, very important. Although so many organizations does not see it as an obligation. They feel that work is separate. Your mental health is your own personal issue that you can deal with. But they don't know how important it is. So we are just trying to, like, with this topic today, we are trying to create an awareness that yes, we aside from we wanting to make it an obligation now in this new era, we are saying that it is a necessity for every organization to include mental health management yes, in the workplace, because it's so very important. Because without people, the workplace, we are saying, cannot even be in existence.
True. So if you're listening to us, thank you, and you're getting this conversation directly from our studio here, you are a work owner, you own a company to yourself, you own a factory to yourself, you own a firm, right, to yourself, where you have workers. It is important that you start taking into cognizance mental health, management. Mental health management is very key, and it is germane. That is what we are talking about today. Now, looking at repercussions when your mental health is not properly cared for, that is mental wellness, there are repercussions to thee. Just like you have rightly said, it affects the workflow and other things. Before we get to that particular segment, can we talk to those that seem not to take mental health serious? Now, before we even get to the office or the company that needs to start prioritizing mental health management, for you, what do you have to tell people that don't see mental health as a major thing or a major criteria to focus on? For instance, there are people that will tell you that, oh, I just have to go to work, and they will tell them from home, do you know that you are mentally not stable at a time like this? It doesn't matter. It's not just for me to go to work. Some people don't even take it serious that the mental health should, if not come first, should be very important. You cannot flow well at work if your mental health is messed up. What do you have to say to people that don't take importance with their mental health?
Okay, Thank you for that wonderful question. I think this is an opportunity for me again to tell the public that
Yes.
when we are talking about self-care, all of us we do self-care, and then they say, "Oh, are you taking care of yourself?" You say, "Yeah, yes, of course. I eat well. I eat well. Yeah, yeah. I eat good diets." It's not all about eating good diet. When we are talking about self-care, it's divided into 4 areas. So we have medical health, we have nutrition, we have personal hygiene, and then we now have mental health. So I like putting mental health on the fourth list, because what, mental health is carrying the other three. So I'm not putting it on top as number one, because if I put it on top, it's like it's standing on the others. So it is a bedrock where those other 3 areas, your medical health, your nutrition, and then your personal hygiene, sit on. Because you take care of your mental health. Yes, you are sick, you have malaria, you take care of it and everything. I've seen people who come to the hospital, they will do general medical tests, all tests for them, and they will not find anything. So when they do that, then the doctors will say, I think the last place for you people to visit is mental health. So when they come to mental health, we begin to see that it's not even about their medical health, it's psychological health, and then we begin to tackle the problem from there. So I would tell people that yes, without your mental health, I always say it, there is no health.
Without your mental
Health, there is no health.
there is no health.
Because once the brain is dead, what happens to other parts of the body? They sit still. There's nobody to give them directives. So they sit there. So they don't even know if, for example, somebody that is brain dead, they'll put him somewhere. He doesn't know if he's hungry. Because it's the brain processes that does all those things before, give directive to the digestive system that, oh, you're hungry, feel hungry. Then the action part comes. That's the behavioral part. That, okay, what's behavior? Oh, yeah, get up from there, go buy food and eat. So, but when the brain is dead, there's nothing. The brain is the powerhouse of the body. So I want to tell people that yes, this is the most important part to pay attention to in the body, is your mental health. Because if everything is not okay here, you see that all other things are okay. There's even a situation whereby some people feel pain medically, but when they go to do tests, there's no pain there. It's a psychological pain. So once they deal with that psychological issue that is making them think that there is pain. And then the fake emotion that is accompanying that pain. Once they deal with the cognitive processes, and then everything is restructured, you just see that all of a sudden the feelings that is attached to the thoughts they have, the feeling, that pain emotion will disappear, and then behaviorally they are fine, they are okay. So that tells us how important mental health is. I used to tell people, take care of your mental health. Take care of it, because if you don't take care of your mental health, it will become mental illness. Yes, that's it.
The point you refuse to take care of your mental health, it becomes mental illness. And
I used to try and distinguish for people that, okay, we have mental health, it's standing like this. We have mental health problems, and then we have mental health issues. So I have seen people who skyrocket from mental health and then jump immediately to mental health without even staying at the middle. So, but if you have a mental health and then you now start having mental health problems, that's like an opportunity for you. Like, yes, you still have the chance to take care of your mental health and return back to your optimal state. Because we see people who literally, yes, would move from there and then go into mental illness directly. So if you don't take care of your mental health, the end result is what we call mental illness.
There's a side at which I want us to, it's an awareness, helping the general public to be aware of their mental health, taking into cognizance the importance of their mental health, especially at workplaces. So it's a two-side of a coin conversation. While we are trying to help people understand the importance of their mental health, we also have to let organizations, management, workspaces understand that there should be a mental health management for every workplace. Let's come to the angle of some kind of jobs, right? Where in most cases, I've heard not once, not twice, this person will tell you that, oh, this thing I do is because of where I work, right? Or this pain I now have is because of where I work. What I am battling with mentally right now is because of where I work. And some people don't just have a choice. They can't find a way out of it. You being a medical practitioner, how best can you advise people? And at the same time, do you have instances of people that are battling with one mental health problem or the other due to their kind of work? And how best can you snap out of these things? For instance, some will tell you that, oh, I got into drinking because where I work, we always drink. Some will tell you that I now have a second wife because my workplace, everybody there, they have two wives. I am saying things that I've heard before. In cases like these, what should people do at a time like that when it looks like it's a regular thing where I work?
Okay. The first thing I will say is that let's look at the role of leadership in an organization. I once worked at a mental health foundation whereby my boss prioritizes mental health. It doesn't joke with it. So fine, there's time for celebrations where we celebrate, and then there's alcohol. But he will be the first person to tell you that no, we are just celebrating for today, so drink responsibly. So he is a leader and he lives by example. He doesn't joke with his mental health. And every time we have a gathering, he lets his staff know that yes, we have a mental health foundation. We have a team of clinical psychologists. Any one of you can walk into any of the counseling rooms, the therapy rooms, and then see a clinical psychologist. If you want confidentiality, even when you are going, you don't need to tell the HR. You don't need to tell anybody. Just walk in there and then have your session. So I think that for an organization whereby you have a scenario whereby it is what they are doing there that is influencing that person to engage in a maladaptive behavior. So for the role of the leader, I think the leaders of organization
has a major role to play.
So they should start prioritizing mental health and then do education and awareness for their staff, so that because you cannot totally rule out celebrations in organizations.
True.
You can't. So even if the boss says, you guys drink responsibly, we still have some people that they just want to use that opportunity to burn out their stress, to burn out their pain and all that, and then they use that opportunity because the boss cannot monitor every individual in the organization. And then for the individuals who are there, drinking alcohol is not a healthy way of coping with whatever pain or emotion that you have. It's not a way of coping with whatever mental health problem or issue that you have. So that I think that's one way.
When a man has injuries on his leg, he will be easily referred to the hospital. Even if not referred, he by himself would voluntarily want to go down to the hospital. If a man has issues with his eyes, he would want to go down to the hospital. Is it a case for mental health that one can just decide and say that with the way I'm feeling, I think I need to see a doctor, a mental health practitioner for my mental wellness? Is it something that is normal?
Yeah, although to me it is normal, but the situation we have today is that people don't speak up about their mental health. Because of that notion, or should I say that misunderstanding of what mental health means, that people think that when you mention mental health, you are talking about madness. People will begin to look at you. So that misinterpretation, stigmatization has made it a challenge for people to walk up to the hospital and take care of their mental health. So it is now that people visit the hospital that we are trying to do awareness and educate people. But I will still say, from here, this is the radio station that like if we have like 10 people that are hearing this topic today, that then he now has understanding that so when we are talking about mental health, we are not actually referring to mental illness. So you must have a mental health first. Then you must now, maybe the person now start having mental health problems or issues. Then if it's left untaken care of, that is when it will now become mental illness. At least from these 10 people, they should educate other 10 or 20 more people that mental health that we have been thinking that when they say mental, you say mad, mental, so that it is not mental illness. So I think with education and awareness, people will learn that yes, mental health is something that you can walk to the hospital, just like you go to the hospital to take care of your medical health when you have malaria, when you have typhoid, when you have eye pain, when you have cut in the leg and all that. It is something that it is normal.
Let's talk about General Hospital. Sorry that I interjected you there. Looking at a man that wants to come to General Hospital and say, my mental health, how is he attended to? Is it not a case where you say, please sit down there first, don't come close? So, how is what is it like? Put us through, give us a picture.
Okay, so just like I said the other time that I came, that yes, we have clinic days. Every department has their clinic days at General Hospital, and Tuesdays and Fridays are mental health clinic days. And if you enter General Hospital on a Monday and you say, please, good afternoon, please, I'm here, I want to see the psychiatrist, mental health, they say, oh, tomorrow is their clinic day, you can come tomorrow. Just go upstairs, go and book a date for tomorrow.
Beautiful.
Book an appointment.
Beautiful.
So you go upstairs, you book an appointment, and then you come.
The upstairs is not where you see people that are on chains and
no,
when you pick number General Hospital, if you are 14, 13 might be on chains.
No, you won't meet people who are on chains, because the clinic we run there, we call it outpatient clinic. Yes. So, but sometimes we have emergencies too, where we have emergency cases that people who are already disorganized mentally and they are already showing signs of delusions, hallucinations, abnormal behavior, restlessness, anger, being aggressive and all that. So those kind of people, sometimes they are accompanied by police, sometimes they are accompanied by securities of the hospital, sometimes by family members, so that will guide them, so that will control. So once they get to the hospital, they call on us, who would also attend to the case immediately, because we don't even want it to cause disruption. So sometimes we manage immediately and then move to the ward.
And because people at home might be wondering, oh, even if I want to go for mental health check now, it's not that my next door neighbor, they might call 13 and the person will say, I'm the 13 and meanwhile he's 15. You can't drive with that kind of
it's not always like that. The clinic we run there, we have stable mental health patients. Sometimes even if you meet them outside, you would not even know.
Wow.
Yes, you would not even know, because they are doing well. Yes, they are doing well on their medications, and once they stay on their medications, they are fine.
At what point can one say there is a brain dead? Is it dead brain or brain dead? I think it's brain dead. At what point can you say that, oh, this person has gotten to the point of brain dead? I'm talking about the point where the brain is no longer functioning. At what point can a man be said to have gotten to brain dead?
That's the point whereby all the brain structures are no more functioning. The cells of the brain are dead. The brain structures are no more.
How do we know the brains are no more functioning?
There's usually a test we do for the brain. We call it CT scan. So sometimes when they bring somebody for assessment and the person sits in front of the psychiatrist, there are certain questions that will be put to the person. How do you test the brain that is working?
Correct answers.
Yes, correct answers. Correct responses. So that's how we know that the mental processes are still intact. So when I ask the question, and I say, oh, what is your name? And they say, oh, my name
Sapele.
And they say, Sapele.
Something is wrong.
Something is wrong somewhere. And they say, what's today's date? Oh, I say, we are in 1985. You know something is wrong. So we call something mental status examination. That's always the first thing that we do. When the person comes to us, that good afternoon, please, I'm here to see a psychiatrist. And I say, okay, what is wrong? And then from the conversation, the person is already saying something else. And then we do mental study. We say, please, sir, what's your name? And then say Sapele. And then what's today's date? And then today is January 1985. Then we know from there that something is actually wrong. So we know the first line of action. Like what's the first line of action to do with this person. So, but a situation whereby they bring the person, and then we are saying, what's your name? And then the person keeps looking, cannot give an answer, and then we pinch him or her, he's not responding to pain. We slap the person, you slap the face, the face went like that and still remain there. Then you know that yes.
Has there been any case like that? Have you witnessed anything such as that before?
I've witnessed such cases. That's in case where in accidents and you understand accident and emergency area whereby the person used the head to eat something and then by the time they bring, we do CT scan, the person is already bleeding internally. So and then from there we know that yes, things are some brain structures would have been destroyed.
Let us talk about mental health problems now. A lot of persons have been dealing with this mental illness for some time and they are not even aware. What they only think is I wake up in the morning, I take my bath, and then I dress up, I go to work. Meanwhile, something is wrong somewhere. What are some of the mental health problems that you think you can list out for people to know that when this is going on, or when this is happening, or when you start seeing signs like this, or you start behaving like this, your mental health is at stake?
Okay, so I'll go with the common mental health illness that we have. So we have depression.
Depression?
Yes, which is common.
Mm.
And depression and anxiety, they are very, very common. Very, very common today because it happens to most people. And why anxiety is common is because there are two hallmarks of anxiety, which is worry and fear. And literally every human worry.
True.
And you fear. Even people fear, what are we going to eat in the night? What are we going to eat tomorrow morning?
How will I get home?
How will I get home today?
How will I go to
How
work
will I
tomorrow?
go to work tomorrow? So all those worry and fear that we do consistently over a long period of time could actually lead to anxiety. So somebody might, you know yourself that, oh, the rate at which you worry last month, this month it has increased. It's not decreasing. And then it increases with
And it
normal,
continues
and it
that
continues
way.
that way. So that kind of person, you know, and then you know that these things have been coming. So when it is now, it has reached a high frequency, there are some physiological complications that combine with it. So for example, the worry frequency increases and the fear increases. Then physiological reactions will now be the heart begins to palpitate faster. The person the heart begins to palpitate. You know, even just ordinary coming in from the door, and then somebody is about to come in, and you are startled because you are already absent-minded. You are focused on the worry and fear that you are bringing. That's what is in the person's thought processes. So you just become startled, and then the heart begins to race faster. The person begins to sweat profusely without any tension, and then shaking of hands and all that. So that person must have been experiencing all that, but because people are not aware of all those symptoms, that once I'm experiencing this is a symptom of mental illness. I need to go to the hospital. I need to find something to do to it. So it is until when it gets out of hand, this anxiety now graduates to what we call panic attack. Panic attack is now, maybe for example at work, the person that episode comes back, that's heart racing, the sweating, the shaking of hands, and then the person falls on the floor. That's when people now notice, and then the person begins to shake. They say, what is this? And some people would target and name it warapa, and it is not warapa. It is what we call panic attack. And then that person that's when they rush the person to the hospital. So when it's brought, maybe by the time they get to the general hospital, that panic episode has where they were, and that person say, yeah, I'm fine, there's nothing wrong with me, and then they go back home. But I just want to educate the public that yes, this anxiety and depression is something that is common today. A lot of people are sad.
Very common.
A lot of people are sad, and sadness, prolonged sadness, is what usually results in what we call depression. So when you start seeing somebody that is now depressed for a long time, a time will come, the person will lose interest in doing things. Low motivation, low mood, low energy.
Everyday work becomes boring.
Becomes boring. It will get to a severe point that the person will now want to stay indoor. Does not want to go out. The person stays in the dark. The person will neglect basic self-care activities like bathing, grooming, dressing up and all that. And if he manages to get up in the house, just dress anyhow and go to work, and when he gets to work, there are some other symptoms like irritability, like the person is easily irritated, is easily hungry and all that. So those are other symptoms of depression.
Now we've gotten to the peak of this conversation, which is talking about areas, workplaces, and how they should take into cognizance the mental health management. But I want to ask this again, talking about treatment now. right? How best can you care for yourself, right? We know if we have headache, it is usually advised that we get painkillers, pain reliefs. If you have malaria or typhoid, there are antibiotics that you should take after being prescribed for. But somebody who wants to care for his or her mental health, what are some tips that you might give out there, you might dish out to the public, that these are the things you should start doing to care for your mental health, to have a stable mental health? What are some of the things you need to start doing?
Okay, I'll start from the very first lowest point, that, for example, let's take a child. A child that is in an environment whereby there is love, there is care, there's freedom of speech, there's support. I think that child will be able to thrive well in that environment, and they might not even have mental health challenges. That type of child has it backed up in his brain that I have a very good background, a supportive environment, a very lovely one. So even if he is facing any challenges outside at school, but having that backup will create a thought processes in that child that I am safe. So, and it will now create an environment whereby even if he gets on, we'll be able to open up and say, oh, mommy, this is what I faced in school. So I now think that for individuals, that they need to be educated more about what mental health is. Like, I'm facing any challenge, just having a conversation with somebody, having somebody out there to pour your mind to, is enough to cut off a sequence of mental health issues.
Just like when they say a problem shared is half
it's
solved.
half solved.
So make sure you talk.
So I want to recommend that what we call counseling and therapy should start early. We call it early intervention. So for individuals, early intervention of talk therapy with a clinical psychologist will always play a role. So sometimes we call ourselves clinical psychologists, and sometimes we call ourselves emotional well-being coach. So emotional well-being coach is not a one-off thing. It means that we have to follow that person up.
It's a process.
It's a process. So when individuals now get to understand now that, yes, even if you are going through the worst scenarios in life, you need somebody to open up to. You need a backup bone. Because accumulation of emotional distresses is not also good. It predisposes people to develop these mental health issues. So, and or you trying to tell yourself, sometimes people will say, I'm strong. Fine, you might be strong biologically. But what about mentally? What if you are not strong? What if you don't have that mental capacity to cope with so much pain? And we call something emotional ventilation. Sometimes it is good that once we are going through the stresses of life and we encounter challenges, we are meant to talk about it. We are meant to reason with somebody else. Like, I'm facing this. What will I do? Having that atmosphere to be able to relate is a good management for to prevent mental health issue. So I would say that people should employ that professional help, like a guidance. Even now we are trying to reach out to secondary schools, and because recently something happened this week, a 19-year-old.
I was going to say who committed suicide due to the JAMB result.
Due to the JAMB result. So, if that girl has had that right atmosphere of mental health education and awareness, I think this suicide should have been prevented. So parents at home too, they have a role to play.
True.
They have a role to play. So we are thinking that, maybe we should go to secondary schools and start telling them to incorporate mental health as a subject, so that from cradle, students understand what mental health is. It is not an abstract thing. It is a real thing, and it happens, and it's about the brain. So I think that as individuals, whatever thing that we are going through, instead of bottling up and then trying to keep it to ourselves, we should try to open up to people around us who can be trusted, and especially professionals.
In quotes, who can be trusted
Who can
and
be trusted.
professionals. 0904081061 or 090408211061 on the studio lines, where you can call us and ask our guests today in the studio questions as regard mental health that we are talking about today. Hello to you, good morning.
Hello, Mr. Delano.
Good morning to you this morning.
About this mental care.
Yes.
About it. So then, when I was small, one man, a doctor, our father, in this place now, he dey tell us, say, we get 202 madness. They are not going to understand how somebody get 202 madness. Every one of us get. The way the doctor is is it true? Somebody get 202 madness.
All right. All right. The doctor will attend to your question. Thank you very much. 0904081061 or 090408211061. So our first caller there wants to know. He said while they were very much younger, they were told that every individual has 202 madness in them. And maybe I should tag it up with another I don't know if I'm to call it a fallacy or some sort of wrong ideology where they tell you that everybody has this 5-minute madness or 1-minute madness. I think maybe that is what he's talking about. Is there anything like people have 202?
No, there's nothing like that. To me, it's a fallacy and misconception of information. When people don't know what it is, they just like try to push it somewhere. So there's nothing like that. So that 5 minutes madness you are talking about, that's just the person is exhibiting his emotion, which is anger. Yes.
So when that happens, they say that's the 5-minute madness.
They say 5 minutes madness. So, but it's not actually madness. It's just a negative emotion you are just exhibiting at the moment, which is anger. It can be anger. It could be frustration. Yes. It could be confusion. And those emotions can make you have maladaptive behaviors. So that's just it.
Let's talk about depression, right? Depression on its own is something that an hour will never be enough to talk about, considering the fact that it's now very rampant and very common amongst our society. Just like you are aware, this very young girl just committed suicide. She decided to take her own life just because of an examination she can rewrite again. And then when I heard that story, one thing that caught through my mind first off was the fact that the environment where that girl is not even really safe, right? Maybe she has gotten very negative words and all of that. I don't think a young girl like that would want to think of committing suicide because she failed JAMB, right? So when you talk about depression, how best do you think people can snap out of depression? There are a lot of people listening to you now that might still be battling with depression because depression is not always written on the forehead. What's the best advice for people who are battling with depression in one way or the other?
Okay, so the other time I explained most of the symptoms of depression, that once you notice somebody behaving in this manner, or you notice yourself that you've been experiencing ongoing series of sad mood, that's the beginning of depression. And this depression too has stages. You have mild depression, you have moderate depression, and you have severe depression. So it literally starts from mild. Mild depression, the person can still be, it's not that consistent, it's just for some time. It was just only yesterday I felt sad. Today I'm happy again. And the reason why you're happy is because something good happened that day, and that changed your mood. But it does not change the fact that that sad episode is still there, is still deep-seated in you. So the only solution is management. And sometimes when people come to the hospital to see the psychiatrist, so it depends on the symptoms you are having, and we usually have there's something we call DSM-5, ICD-10. So it's like a manual, and then when we are now that manual, we have mental health illnesses in there that are listed there. So in there, the symptoms are listed. So there is duration. So if somebody, they say, oh, you've been sad for the past 2 weeks. So if it is just 2 weeks, so we can still like place the person under mild depression, that, oh, this person has just been experiencing this thing for 2 weeks. It's not that long.
It's a very short time.
It's a very short time. So in that scenario, the psychiatrist might decide that, oh, let's not start medications with this person yet, since it has not even passed 2 weeks. Okay, you can go see the clinical psychologist. Then that kind of person is directed to me. Then we now start therapy session. So the therapy session, we call it CBT. And CBT, cognitive behavior therapy. And cognitive, what we mean there is that, yes, for that person to be sad, it has to do with the thought processes. So we have to work on the thought processes. We have to work on the behavior of the person. We call it behavior activation. That, oh, we have to initiate pleasurable activities into the person that the person can use to get out of that sad mood and then pass that phase. So even without medications, that's for mild depression. But if the symptoms the person is reporting is more than, then that means it might have to go into moderate depression. And for some people, we have severe depression. So moderate depression, we might help the person with medications, but it might be for a short while.
Okay.
So just like to put things back in order. So depression is just similar to when you go to medical health, you have malaria, and then they say take this medication for 5 days to kill the virus in your body. Sometimes if you take it for 2 days, you feel better.
Exactly.
But you have not killed the virus. So depression too is like that. So we help people with that too. That, okay, that depression, we place it as a virus too that we want to kill. And then the person has to go on those medications for a while to actually kill that virus depression, and then you are back to your normal self. But when we are doing medication management, we always support it with therapy, because fine, you might take the medication and you'll be fine, but you will still, if you are not educated well, you will still go ahead to return to your old ways that caused the depression in the first place.
So it's more like you're back to square one again.
Yes, it's more like a back to square one. So medication management and therapy management is what we do. So we encourage people that, yes, if you know that you've been battling with depression, you've been battling with anxiety, or any other mental health issue, it might be trauma related. You know, we have people who have gone through trauma and they've developed post-traumatic stress disorder, and at any little danger they overreact because of the trauma that they've gone through in the past. So the best solution is for you to seek help. Seek help from a professional, and that is at the hospital. We have it at General Hospital Ikorodu. We have psychiatrists there, and we have in other places too, in Lagos State. So if Ikorodu is far from you, you have other mental health facilities that are very close to you, and you need to seek help before it gets too late.
We're gradually wrapping up and we have to leave the studio again. But this will be my last question for today. Talking about mental health and the workplace. You know, these days, there were times that it was very common while we were growing up. Then you go to an environment, a place, a workplace, even schools. You see first aid boxes there. Yeah. But gradually these things are fading away. You hardly see first aid boxes. And now you are talking about mental health management. Offices, companies, firms should start considering mental health management. Yes. How visible do you think this can be? Knowing fully well that even first aid is not even taken into cognizance anymore. Would it now be mental health management they want to consider? How visible is it? And what should your advice be to companies, factories, and office workspaces?
Education and awareness.
Education and awareness.
And this radio program we are doing is education and awareness.
True.
So another thing we could do, for example, in workspaces, let's create a supportive culture. Just like I was talking the other time that I said the role of leadership has a very great importance in mental health management. Like, yes, you the boss of the organization, if you understand what mental health is, if you know how important it is that without a good mental health state for your employees, your productivity is at stake. So if you know the importance, you would prioritize mental health and you will create a supportive environment and culture. In fact, aside from environment, make it a culture that mental health is a thing that yes, we must prioritize in this organization. So aside that, then awareness, we could have something maybe like a banner or something that even when other customers walk in, they will notice and see that mental health is something that is prioritized in this
organization. There will be a consciousness.
Yes, there will be a consciousness. And with that, you know, customers that come in will know that so this employee cannot talk to me anyhow. For example, when you enter some banks, you see that even the employees are the ones that even add to people's mental health issues.
True.
With the way they relate with you.
True.
With the way they do everything, they just make everything seem like a big deal to you. So with that creating awareness, maybe with a standing billboard or something, let people know that mental health is prioritized there. Aside that, regular check-ins. And what do I mean by that regular check-ins is that yes, create a therapy room. And then you know that this service is available. Let your staffs know that yes, they can walk in at any time. And then let them create an enforcement that nobody should stigmatize mental health in the organization. And nobody should stigmatize that once a particular employee goes inside a counseling room to see a therapist and then they come out from it, they begin to gossip that I think she has maybe she has this, maybe she has that. So we need leaders in organization to enforce that law, that no stigmatization about mental health. Because the person might just need somebody to talk to.
True.
And then after talking to the therapist, he or she feels better and then goes back to the work, and then the work goes on fine. So aside that too, we also need trainings. Yes, trainings. And when we are talking about trainings, in psychology we call it employee assisted programs. That's what we call it. So there are some employees that yes, they came in, but they are not really, they don't know everything about the job. And then not knowing everything about the job, tasks are being given to them. That can even put pressure on them. That can make them to strain themselves even more and overdo. So we need leaders of organizations to create this training employee assisted program so that anywhere people have problems, they will better train them more and let them know. So if that kind of training is created, that will reduce stress and burnout in employees.
I want to thank you so very much, Mrs. Omolola Iyakin, who happens to be a clinical psychologist from General Hospital Ikorodu. This is how far we can have the conversation on mental health and the workplace for today. It's always good to have you here in the studio, and we hope that next time we would have more of you again. 1 hour is never enough to get all of these learnings from you. Until tomorrow, same time, same station, the issues continues. I am Opeyemi Adebambo. Remember to take seriously your mental health. It is very, very important. It is key. Until tomorrow, same time, same station. God bless Nigeria. God bless Lagos. God bless Ikorodu.